Good morning. I am going to talk about the gastrointestinal system. Examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. Note, if the abdomen is distended by fluid or gas, the presence of fluid can be confirmed by demonstrating shifting dullness, percus, or tap first with the patient lying supine flat on their back, then ask the patient to lie on one side and percuss again. If fluid is present to the dual node hard on percussion moves. Palpate each region, feel for tenderness, pain when touched or masses. Palpable enlarge of tissue. Note also any guarding or rigidity shown by contracting of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax rigidity, however, is constant and is due to peritoneal irritation. The faces. There are several words for the faces. Doctors sometimes says there was a blood in the stools or have you passed back stools? Patients sometimes says my motions have been very loose lately. Bowel movements is used to refer to defecation. How your bowels move today? Have you had a bowel movement today? Bowel habits. It's a medical expression meaning the partner of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea. Frequent soft or liquid stools. Normal stools are brown in color and semi-solid or formed. The consistency or degree of hardness and softness can be shown on a scale. Hard, formed, semi-formed, soft, loose, and liquid, watery. The color can vary from black due to altered blood, as in melanina, to yellow, green, or even white. Melanina stools are often described as terry. Like tar, the black sticky substance that is used in road making, the stools may be red when fresh blood is present. Blood that can only be detected with a special test is called fecal occult blood. When there is a high fat content, the stools are pale and are sometimes described as clay color. Thank you. Now I'm going to read the exercise. Complete the case report. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius, pulse 100 per minute, blood pressure 110 per 18. Examination of the test of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with guarding but not rigidity. There was no rebound tenderness and no masses were felt. Bowel sounds were reduced. To match the description of the stools with the condition most likely to cause them. Loose, bloody, with ulcerative colitis, loose, pale, bulky, obstructive jaundice, clay and colored, with cholera, black and terry, gastric ulcer, small and hard, irritable bowel syndrome, and clear, watery with mucus, Coeliacal disease. Match the fears to the doctor's question. Blood. How do you pass black stools? Bowel habit. How often do you open your bowels? Change in bowel habits. Are you going to the toilet more often than normal? Bulk. Is the size or the amount of the stool normal? Color. What about the appearance of the stools? Consistency. Are the motions hard or loose? Of seaviness. Do the motions have an usual smell? Ahora voy a leer los ejercicios en español. Completa el caso 14. La exploración física reveló una niña delgada con ligera palidez. No presentaba deshidratación evidente, la temperatura era de 38 grados Celsius, el pulso de 100 latidos por minuto y la presión arterial de 110/80 milímetros de mercurio. La exploración del resto del aparato cardiovascular y respiratorio fue normal. El abdomen no estaba distendido, se observó dolor en la palpitación generalizado, más marcado en el cuadrante inferior derecho y asociado con defensa, pero no rigidez. No se observó dolor a la palpitación por rebote, ni se palparon masas. Los ruidos intestinales estaban reducidos. Parea la descripción con las condiciones más correctas. Suelta y sanguinolenta con colitis ulcerosa, suelta, pálida y voluminosa, y ictericia obstructiva, color arcilla, enfermedad celíaca, negra y alquitranada, úlcera gástrica, pequeña y dura, síndrome del intestino irritable, transparente, acuosa y con moco, cólera. Y por último, parea las palabras con las preguntas del doctor. Sangre. ¿Ha tenido heces negras? Hábito intestinal. ¿Con qué frecuencia defeca? Cambio en el ámbito intestinal. ¿Va al baño con más frecuencia de lo normal? Volumen. ¿Es normal el tamaño o la cantidad de las heces? Color. ¿Qué aspecto tienen las heces? Consistencia. ¿Son las heces duras o blandas y son desagradables? ¿Tienen las heces un olor inusual? Es cuanto.